In this video, we're going to talk about sublingual hormone monitoring. So when we say sublingual, we're really just going to cover anytime a hormone is taken in your mouth and it's absorbed in your mouth. So it could be a lozenge under your tongue, in between your cheek and your gums, or it could be drops taken under your tongue. Those are going to be a little bit different between those different types of sublingual hormones, but this video will cover any of those scenarios. This is also a scenario where we have to be really careful. It's tempting to go into these questions and ask ourselves which lab tests works really, really well for oral hormones or injections or sublingual or whatever it may be. However, if we look at sublingual hormones, what we find is really there aren't any good answers for reasons that are different for each test. So let's just go through them one at a time. Why doesn't serum testing work well for sublingual hormones? Pretty simple. It's just too fast. So if you look at the data from this study that we have here, what you can see is 3 different doses of sublingual testosterone in female patients. And what you can see is increasing levels with the increasing dose. But when you look at the kinetics, the speed of this, at 2 or 3 hours, you're almost back to baseline. And there's no difference between the lower dose and the higher dose. So you have 2 options. Either you test later in the day and it's gone, or you test during that peak. And look how narrow that is. There's no way you can effectively monitor that. You're simply shooting at a moving target, or it's already gone. Neither one of those situations is going to work very well. For saliva testing, of course, it's ridiculous to use saliva testing with sublingual hormones because you're taking literally 1 billion times more hormone than is in your saliva. And where are you putting it? In your mouth, right? Now, we just saw from the serum testing that the systemic increase in hormone happens in a couple of hours. So what you're asking is, I'm asking that hormone to go in my mouth, absorb in my mouth, increase my levels, and then get out of my mouth so it doesn't contaminate my saliva. And it's got to happen so quickly that I actually get a meaningful number in my saliva. So the point is, there's a meaningful value surging through your saliva, which is tiny. And then on top of that, you're adding this massive contamination. So it simply doesn't work. Some saliva labs will tell you, look, if you wait 30 hours or so, then you can test after that. And that's true. If you wait 30 hours, you can test. But what are you getting? You're either getting a baseline value or you're getting residual contamination in your mouth from the supplement itself. Neither of those values are effective in monitoring sublingual therapy. That does not added value. There's no reason to test. So when you look at urine testing, you've got this quick up and down in blood. And urine testing is perfect because you can collect over time. You can capture the whole thing and look at that, right? So doesn't that work? Well, yes and no. If that's all you were looking at, it would work really, really well and urine would be ideal. However, if you take your dose and you absorb, let's say, half of it under your tongue and the other half of it gets swallowed, the half that gets swallowed creates what? You get first pass metabolites, meaning, let's take testosterone. Testosterone goes in my mouth and it gets absorbed and it goes systemic. The other half of it gets swallowed, goes into my gut as testosterone. In my gut, before it gets into circulation, it gets turned into the conjugated form that we find in urine. And that gets in your urine. That value is fairly irrelevant. That hormone has never been in systemic circulation. Now, unfortunately, from the research that I've done just using doses on a one at a time basis on myself, looking at swallowing, sublingual, and looking at different values, what the data tells me is that if you're careful, you'll swallow about 20 to 50%. And when you take a dose and you swallow a dose, the amount that ends up in your urine is far larger from that first pass metabolism than the same dose taken truly sublingually. So essentially what you've got is you're bloating the values with testosterone that doesn't count, if you will, or estrogen or whatever it is you're taking. So the values in urine would really only be effective if you didn't swallow any. And you'd also need to do that for at least the day of the collection and probably the day before for estrogen Probably the day of is enough for testosterone because it clears out so quickly. Progesterone's a little bit trickier because you'd have to not swallow it for probably 3 or 4 days to get a good value. Now, how do you not swallow it? Well, it's pretty tricky. So most people just don't use urine testing for monitoring the dosage of therapy. Now, you can look at the metabolism patterns, and that's interesting. But if you want to monitor the actual dosage, what you can do, which is a little bit tricky, but is to collect your saliva, say in a cup, while you're administering your hormone. So let's say I'm taking drops. If I put the drops under my tongue and it's absorbing, and all the while, if I have to swallow, I'm actually spitting in a cup and getting rid of that specimen. That is a creative way that you can keep the hormone from going into your gut and getting the first pass metabolites. And then you're really monitoring truly that systemic absorption from the sublingual hormone. That is not easy to do, and you really have to do it for multiple days for some hormones. So getting patient compliance might be a little bit tricky. That is the only way that I've been able to effectively monitor therapy when it's taken sublingually. But again, it's not easy to do. So this is a scenario where we may not have a good solution. So you're going to have to lean more heavily on the clinical picture when it comes to dosing, and maybe use the urine testing to look at metabolites. The patterns still matter of how do I metabolize my estrogen, and you can look at that. But again, when you're looking at dosing for sublingual hormones, it's a unique, tricky situation where the lab values really aren't very ideal for asking the question, do I have enough hormone? Do I have too much hormone? It just doesn't work that effectively. And it's better for you as a provider to know that and either change to a different route of administration or lean more heavily on the clinical picture as you dose sublingual hormones, because they can be effective clinically. And there are some situations where giving it sublingually has a real benefit in terms of the convenience and the way you can scale the dosing. Now, there is one exception to this, and that's with DHEA. DHEA is commonly taken sublingually. With DHEA, when you take it for a while, you're going to build up your levels. If you skip it for a day, your levels really aren't going to change that much. And we're not just looking at DHEA, right? We're looking at the downstream metabolites. How much testosterone did I make from that? How much estrogen did I make from that? So with sublingual DHEA, I think it really is a reasonable option to simply skip the sublingual dose the day of the test and to test. And you can probably do that using either serum or urine testing. I would much prefer urine testing in this particular scenario because I'm so interested in the downstream metabolism of the DHEA, and you simply get a lot more information on that from a urine test. But sublingual hormone is difficult all the way around to monitor no matter what test you're using. So you need to be really careful when you're using sublingual hormones in terms of how you're monitoring the dosing for your patients.